Hello again. Thank you for joining us on this Thursday morning here on the South African Morning on Channel 403. Now, health professionals and organizations insist the national health insurance remains unimplementable. They say government's compromise is not going to make it workable. Yesterday, they've proposed a framework for far-reaching healthcare reforms in the country. To tell us more about this is Dr. Aslam Dasoo, Universal Healthcare Access Coalition Steering Committee member. Dr. Dasoo, good morning. Thank you very much for your time. What are you proposing to resolve this whole issue around the NHI and to ensure that there are far-reaching healthcare reforms in our country?
Good morning, Ronan, and good morning to your viewers. Our proposal is actually something that has an historic precedent in that it was the health policy that was being unfolded in our country that was adopted by the first democratic parliament in 1997 and which was then summarily stopped with the assent of the Jacob Zuma administration, completely, as we call it, defenestrated, just thrown out of the window, and replaced with an uncosted, unresearched NHI. And for the last 17 years, this NHI proposal has gone through several iterations, being retrofitted with policy plugs, giving us this NHI Act to which President Ramaphosa has recently assented. And what we can see is that it's a completely unworkable plan, given the situation that we have and given the systems that we have. It's also, you can't pay for this thing. It requires tax hikes, and we can't have any further tax hikes in the country at the moment, as the finance minister has informed us. You're going to need far-reaching legislative changes, a dozen acts of parliament, constitutional changes to enable it to be promulgated. And even if it were to be promulgated, its provisions are such that they can't actually deliver on the system in any short space of time to give us equitable health coverage for everyone.
Is there a faster, cheaper, implementable fix to our healthcare, our health crisis currently, that is not NHI?
Yes. So what we have proposed is the plan that we've put together. So this comes from the original plan. It accounts for the 17 years of almost zero healthcare reform, during which time the public system has been collapsing around the ears of the management of it, which is the provincial health departments, reducing access to healthcare for the overwhelming majority of people. 80 to 90% of the population rely on the public health system, and it's really beleaguered, and it can't continue the way it is. The private sector, on the other hand, has been completely unregulated, and despite the private sector parties agreeing to proper, global standard regulation, the government has done nothing about it, resulting in an overheating system, market failures, too expensive even for the middle classes that enjoy it. So this plan brings it all together. It covers that area. It covers the deterioration in the system. It proposes a reorganization of what we have in the country today, non-threatening way, and it's faster. It requires no further funding. It can occur within the current fiscal framework, no far-reaching legislation, and there's no litigation against it, which really should tell us a lot when the government says they can't discuss it with us because it's sub judice. Their NHI is under litigation, not this plan. And this plan they can discuss with us now. It's immediately implementable and can give us a vastly improved health system with equitable access. We look at equity first within 3 to 5 years.
So a short space of time. Now, there's over 20 healthcare bodies that are signatories on this new plan, these proposals. What would you do if government does not consider them? Well,
they've basically told us they're not going to consider it. They're so beholden to their NHI, which is an obstinate approach, and we think completely unnecessary, because this act is going to be mired in the courts for a long time. There's several cases lined up against it. And we're saying that the system that we've proposed, it's well-researched, it's evidence-based. Number of commissions have been looking at the health system. It brings them all together. it gives us a seamless system of access, universal to healthcare. So you've got the public sector differently governed. That's really all it requires. Major reforms in its governance so that we can repair and rehabilitate and make it the system of world-class standard that we always believed it was capable of becoming. The private sector similarly will be integrated into this without any threat to the private providers in any way, and just organizing the funding in medical schemes to make it mandatory for high income earners, and to allow for a large public scheme to catch the missing middle who are in employment but can't afford medical aid. This will allow them to be able to access private specialists. But if they need admission, for example, it could be in an accredited public hospital where the private specialists could treat them. That's the beginning of integration. And no one is left out of the net. Everyone in South Africa, as the Constitution entitles them, will have access to necessary care without any impediment.
Yeah, my question, though, was that now they've said no. You say they won't consider it. Very briefly, Dr. Dasoo, what are you going to do now?
Well, listen, this is you said already, it's actually 28 organizations that have signed up to these proposals, all in the health sector. We've gone very broadly. 50 organizations attended our summit last week, and 54, I beg your pardon.
Yes.
And everyone very comfortable with this. They're all intending to sign up. They're looking at some aspects of it. This is a document that will still benefit from further input of the greater wisdom of the sector. But we're telling society now that we've been to the government, we've been to the president, we've been to the Ministry of Health, and we've been talking about this for years. We are coming to you now as your health workers. Your tax rands trained us. We understand how to optimize the delivery platform. We understand how it can be funded, and we want everyone to have universal access to it. And society now is being enlisted in joining us in telling the government, your NHI, whatever it is, and however you want to look at it, is not the answer. Here's the answer. The system can't wait for you to have an internal cases and to have it implemented over far.
Thank you very much, Doctor. Thank you very much, Dr. Aslam Dasoo, Universal Healthcare Access Coalition Steering Committee member. Government is not considering their proposals. He says, Maseko will have to wait and see now what's going to happen. But the health professionals are saying NHI is not going to work.
Yeah, well, let's see what happens even next week when the finance minister tables his budget for this year and whether or not he'll let us know what the price tag is on this new act.